talking to you a little bit about nursing and what it takes to be a nurse. I am a second-year master's student at the College of Nursing at the University of Illinois at Chicago. Why I chose nursing? I chose nursing because growing up I saw my mom, who only spoke Spanish, struggle a lot during her doctor's appointment, and I wanted to be part of the solution to that. Being a Spanish speaker, I wanted to work in the medical field to be able to communicate with those who don't understand any English and who only speak Spanish. I wanted to help my community out in the future, being anything in the medical field. The training that you need to become a nurse is right after high school. You can go right into a university and get a 4-year degree to become a nurse. I took a longer route. I'm actually getting my master's. So I got my bachelor's in psychology and now I'm getting my master's in nursing. So that takes about 6 years for me, when it normally could take only 4 years. The skills that you need to be a nurse is you need to be very caring, you need to be loyal and dedicated, and you need to be very hardworking. So nursing school is very difficult, so you need to be very dedicated to the work that you're doing, to all your classes and to your exams. You need to be very caring because you're going to be taking care of a lot of people. And you're going to be making sure that they're okay. You're going to be working with them every single day, and you also need to be a team player because you work with a lot of different nurses. You work with doctors, you work with a whole bunch of people in the hospital. There's a lot of people in the hospital and you have to work with. The equipment that you need to be a nurse is a stethoscope. So this is to listen to your heart and lungs of other people. And you need a notebook to always make sure that you're writing everything down. You also need a pen light. So this light, you can look into people's eyes and observe what they're looking at and just check out their pupils. Then you need a blood pressure cuff. So this is to take blood pressure and make sure that people's blood pressure is at a healthy level. Right now with coronavirus, every nurse is required to always wear a mask. But usually we wear masks when patients have a high rate of an infectious disease. So usually back then in a normal hospital, there would be a white cart outside of a patient's door, and then there you can grab a mask, some gloves, and gowns. You also get to wear pajamas all day. So these are the scrubs that I wear to work and that I do everything in. So if you become a nurse, you get to wear pajamas all day. And I also like to kind of have some fun with it and wear my pink socks. And it took me 6 years to become a nurse because I did take a longer route. I did get my bachelor's and now I'm getting my master's. It's taking me a little bit longer than usual, but you can also, right after high school, as I mentioned before, go right into a university and get your nursing degrees. The challenges that I face being nurse is actually during nursing school. I have to juggle studying, making sure that I go to work, and make sure that I spend time with friends. It's kind of difficult because I need to keep up with all my schoolwork, and classes in nursing school are very difficult. So you need to make sure that you study every single day, and you need to be dedicated, as I mentioned, to your schoolwork. The thing that I did learn that I still use today, even in my clinicals, is vital signs. So vital signs are very important. You take them every single day with every single patient that you get, every 4 to 8 hours, depending on the severity of your patient. So vital signs include our heart rate, blood pressure, our respirations in and out, temperature, and then the last one is pain. So you want to ask your patient, how much pain are you in today, from a scale to 1 to 10, 1 being no pain, 0 being no pain, 1 being a little bit of pain, and 10 being the most severe pain that you've ever felt. The advice I give to you if you do want to become a nurse is to be very dedicated, get good grades on all your science and math classes, and just work really hard. If you really want to be a good nurse, you need to be caring, and you want to be able to work with a lot of people. And if you do want to be a nurse, I commend you, and I really hope that you will make a good nurse, and I know that you will. And thank you so much for listening to me. This is what it's like to be a nurse, and I hope you choose this career for the future. Thank you.